The number of obese kids worldwide has soared dramatically from 11 million in 1975 to 124 million in 2016. Many countries in the Pacific Islands topped the list with over 30% of kids estimated to be obese. The United States was not far behind, with rates at 20% or over for the 5 to 19 age bracket. If this trend continues, we'll see more obese kids and underweight children by the year 2022.
So why are they gaining so much at such a young age?
So Glenda, so globally, people have access to ultra-processed, calorie-dense foods. We're talking about this, that are cheap and nutrient-poor. Just like here, many cultures are surrounded by unhealthy food options, and for those with limited incomes, they simply can't afford to buy nutritious foods, it seems.
Now, obviously, this falls to parents to fix this. What can they do? So,
Stephen, you know, when it comes to high-income countries like ourselves, America has the highest child obesity rates. There are many things caregivers can do, including parents, to prevent childhood obesity. So here are my prescriptions. Number one, encourage nutritious eating habits, right? Discuss how the body thrives on fruit, veggies, whole grains, lean meats, fish, and beans, and not fast food. Keep tempting foods out of your home. Eating small treats in moderation is fine, but limit high-fat, high-sugary snacks. Also, talk to your kids about physical activity and exercise. They need 60 minutes a day. Explain how they can increase their self-esteem, strengthen their bones, decrease anxiety, and help maintain a healthy weight. And lastly, reduce screen time. Kids sit around all the time watching TV and playing games and electronics all the time.
Yeah, so, I mean, how does obesity affect a child? Remind us what it does to them.
Absolutely. So Glenda, children who are obese face many obstacles. They can be picked on, teased at school, low self-esteem, social isolation, depression, higher risk for bone and joint problems, sleep apnea, asthma, diabetes. One study found that 60% of those kids had at least one risk factor for heart disease. So huge problem.
Wow.
Huge problem.
All right, Doc, thanks so much.
Thank you so much. If you have a question for the good doctor or a health concern, you can email him at drnandy@wxyz.com or send it to us on Facebook or on Twitter.